Based on long-term follow-up studies, we may assert that this addiction treatment program has a success rate of 85 to 90% for opiates such as heroin, methadone, Subutex, Tramadol, Substitol, and Trodol. Diagnostics is the first and most important phase of treatment. The essence of diagnosis is to assess the physical and mental condition of the patient. In order to assess the physical condition of the patient, the standard diagnosis examination includes urine tests, tests for hepatitis B and C as well as for HIV infection, general analysis of blood, biochemical blood test, ECG, examination by the internist doctor. In order to assess the mental state of the patient, a standard diagnosis examination includes psychodiagnosis, psychological tests used to determine the level of dependence, the extent of the effects of opiate consumption, whether there are signs of mental disturbance, whether depression is present, degree of motivation for rehabilitation, self-criticism, and the conservation of voluntary mechanisms. After diagnostics, the results are examined by a team of doctors in order to develop a treatment strategy and plan. In case that the diagnosis reveals serious deviations in the tests, the presence of risk factors or chronic accompanying diseases, there can be organized additional tests or treatment for the accompanying diseases. The complex method includes UROD, ultra-rapid detoxification from opiates, NeuroJet or NED therapy, pharmacotherapy, special infusions of vitamins, hepatoprotectors. It is extremely important that detoxification is fast. The patient should feel no pain and the sleeping habits and appetite of the patient should return to normal. The patient's mood should become stable without any anxiety or depression. UROD, or ultra-rapid opioid detoxification, is a modern and extremely efficient method that aims to accelerate the cleansing process of the organism and at the same time to reduce the intensity and duration of unpleasant crisis symptoms. During the ultra-fast detoxifying, the patient is under anesthesia for 6 to 8 hours a day. Opiate antagonists, usually naloxone or naltrexone, are gradually introduced, releasing the receptors from opiates. The essence of ultra-rapid detoxification is that patients should go through most of the crisis symptoms while they sleep and feel no pain. When they wake up, the worst part of the crisis has already passed. NET, or NeuroJet therapy, is a method that affects the neurons responsible for the secretion of endorphins in the brain by means of special impulses issued by a NeuroJet device. NeuroJet stimulation is painless. The patient feels only a slight tickling and vibration. The frequency and intensity of the impulses is computer controlled. After 15 to 20 minutes, abstinence symptoms disappear or their intensity is reduced by 70 to 80%. Pharmacotherapy is one of the elements of detoxification. Depending on the results of the diagnosis, during the process of detoxification, there will be used a combination of medications which eliminates the basic symptoms of abstinence, as well as preparations which are part of pain management standards and provide good protection from pain. The treatment also includes a lung cleaning therapy in order to eliminate the consequences of narcotic inhalation if indicated, special infusions with neurometabolic substances, nootropics for the enhancement of exchange processes in the brain, and hepatic protectors for the regeneration of the liver. All the products used in pharmacotherapy are safe and create no dependency. Physiotherapy. When a person goes through the process of quitting drugs, dopamine levels are lower than in the case of non-addicts. Massage helps to normalize the process of dopamine secretion in patients undergoing addiction treatment. Massage contributes to the process of detoxification by accelerating blood circulation and lymph flow, accelerating thus the elimination process of toxic substances in the body. Fourth phase is psychological dependence treatment. Information therapy is aimed at eliminating the desire for narcotics on a subconscious level. The patient spends a couple of hours in a medically induced sleep under audiovisual stimulation coming from a computer with the help of special headphones and glasses, which transmit high-frequency signals. Because if the patient is conscious, we may encounter mental blockings such as "I am not an addict, I do not need that does not help me, it has no effect on me," etc. For the psychological aspect of the addiction, further methods are used: individual psychotherapy, group psychotherapy, physically oriented psychotherapy, meditation, autogenic training, relaxation, art therapy, transactional analysis, family therapy, individual and group training. At the end of the treatment, a pharmacological blockade will be carried out in the form of an implant, naltrexone. The purpose of this procedure is to block the opiate receptors of the patient through the effect of naltrexone. In that way, the patient will not achieve euphoria or similar sensations in case of using heroin, tramadol, or methadone, and therefore there will be no relapse and return to drugs. Naltrexone therapy is applied to patients who have undergone detoxification from opiates. Our patients are advised to use the protection of implants for at least 12 months after release from hospital. Our program includes the transportation of the patient from the airport or station to our clinic, as well as return after treatment. At our clinic, doctors and nurses are available to patients 24 hours a day and 7 days a week. All doctors are certified anesthesiologists, psychiatrists and psychologists with 10 to 25 years of experience. The clinic employs more than 60 people. Security staff guarantees the safety of our patients and personnel. The building is under video surveillance. Patients are accommodated in comfortable double and triple bedrooms with bath, shower, closet and TV. Rooms are cleaned twice a day. During their spare time, patients have at their disposal billiards, table tennis, yoga, gym and cinema. The clinic has a safe where patients can deposit their personal belongings, which should not be left in the room. In the case of foreign patients who need a visa, we can help them to obtain it. If patients from abroad are accompanied, their companions can stay at our clinic.